Now, these babies have increased muscle tone, and this is probably the most popular symptom that we see. Tone is just basically the ability of a muscle to resist movement. So tone is also referred to as recoil phenomenon. This means when a muscle is stretched passively, like stretching down his arm or his leg, then it goes back to its original position. Tone should not be assessed when the infant is asleep or crying. It's not fair to score a baby because he's crying because his diaper is dirty and he's holding himself stiff. Therefore, we gently wake the baby and make sure that he or she is happy and not crying before we score tone. To assess muscle tone, we take the baby lying supine in the bassinet, grab his hands, and pull him straight up to a sitting position. Now, the normal term infant will attempt to bring his or her head up in line with the body, but isn't quite able to do it. As you can see in that top picture, his head lags behind. But if the infant even is able to hold his head up, it's only for a second and it will fall back down. But these babies, when we pull them up to a sitting position, sometimes they stay there almost like they're stuck. So that is increased tone. Excoriation. We talked about sore butts from diarrhea, and we try to head this off at the pass. But excoriation can also be the result of constant rubbing of an extremity against a flat surface, such as their elbows may become excoriated, the backs of their heads, because they're constantly in motion. They're constantly uncomfortable. So if we have excoriation present on the chin, knees, cheeks, elbows, toes, or nose, we score it. And remember, if it's just a reddened diaper area, we don't score it if it's related to loose or watery stools, because that actually scores under loose and watery stools. So when we talk to these moms, many of these moms also have scratched up faces, and they have cuts and nicks over them because they have that same constant, jerky, repetitive motion that these babies have. Now, speaking of jerking motion, myoclonic jerks are a little worse than tremors. These are involuntary spasms or twitching that you usually do not see in the newborn period. It's not quite as bad as a seizure, but as they become more pronounced, they can resemble a myoclonic seizure, or they might disappear like a single or multiple jerks of arms or legs. So if that repetitively happens, we score them for myoclonic jerks. So if the infant expresses twitching movements of the muscles of the face or extremities, or if the jerking movements of arms or legs are observed, we score them as jerks, not tremors. And probably one of the most severe cases that we've seen, and it happens in 2 to 11% of infants exposed to opioids, especially when they're untreated, is seizure activity. Now, there are a lot of studies that examine the incidence of drug-related seizures, but in all the infants who have experienced seizures, they did have other withdrawal symptoms before the seizures started. So many of these were babies that maybe weren't scored. They were born in a hospital that doesn't recognize neonatal abstinence syndrome. Many are born at home, and the mothers deny seeking care. So in general, these seizures occurred after the baby has had symptoms of neonatal abstinence syndrome, and usually they're about 10 days old. And we refer to these as tonic seizures, and that's just generalized activity like you've seen on TV or, you know, people having a seizure. It looks just like that in a baby. Now, sweating. We would score the baby on the Finnegan scoring system as a 1 if the baby has forehead, upper lip, or back of the neck sweating. Now, if we have the baby wrapped up in multiple blankets and it's very hot in the environment, we give that baby a chance to recoup that, and we would unwrap that baby. So if mom was holding the baby skin to skin, or if grandma was holding the baby and had, you know, a couple of Afghans on the baby, then of course sweating is a natural thing. But this is sweating when they're not in an environment that has heat. Next is fever. We do score and take vital signs on these babies every 3 hours. So we score 1 if the temperature is less than 101, so that would be 99 to 101. And the baby would score 2 points if the temperature is over 101. And we actually take an axillary temperature, which is a temperature under the arm. We don't want to do repeated rectal temperatures on these babies because that's just not safe. Now note, it might be important to keep the infant dressed consistently because you can see fluctuations in temperature if the infant's dressed in extra clothing. So if that's the case, Unwrap the baby, dress him in normal clothing for the environment, and recheck the temperature. Yawning. Yes, all babies and all people yawn, but these babies yawn a lot. These babies will yawn more than 3 times within that 3-hour period. So during your observation of these infants, and as you can see, they require very close observation, if the baby yawns more than 3 times in the testing period, then you're going to score for yawn.